It is your hometown station, AM 1220 KHTS. I am Kyle Jellings, and for a special little segment here with a very special guest, make sure you go to hometownstation.com for all the latest and greatest in the Santa Clarita Valley. And speaking of the greatest in Santa Clarita, I have a very special guest in the studio, Dr. Gilbert Snow. He's been creating beautiful, healthy smiles in the Santa Clarita and Antelope Valleys since 1971. He has gained a reputation for providing the highest quality and most modern orthodontic treatment available. He has several offices throughout the Los Angeles County and one right here in the Santa Clarita Valley, and he joins me in studio now. And Dr. Snow, how are you, my friend?
I'm just fine. Thank you, Kyle.
Yeah, and so I am the one, I get the kids on the air during my hour, and I get all the dental tips courtesy of Dr. Snow.
Yes.
And so talk to me. You've been doing this a long time. You started in the Antelope Valley going to schools with the kids. So talk to me about this program.
Yes. About 27 years ago, I wanted to assess the dental needs in the Antelope Valley. And so I approached the Lancaster School District to do a study on what the needs were. We went to various schools and did school screenings, and we found that 10% of the kids around 9 years old in that age group had never seen the dentist before. 20% of them hadn't been to the dentist within the past year. And so with that thought in mind, then, we started doing regular school screenings, and I've been doing that since for about 27 years now. At the same time, we went ahead and started a 5013C, a tax-deductible organization, wherein we treat dental, all forms of dentistry for kids that can't afford it any other way. And we've been doing that for a number of years and treated lots of kids for no cost, those that can't afford it.
And when you do you said you do screenings at the schools. What is that?
Yes.
What does that mean?
Well, what that means is we first of all give a demonstration, and we talk about oral hygiene and lots of discussion with the kids, which has become very interesting and actually fun to do. And at the same time, after we're finished with that, then we examine the kids and send the examination sheet home with the kids to the parents, where they can take the appropriate action, both in general dentistry and things to do with their bite and orthodontics.
That's fantastic, and that's an awesome thing. You talking about, kids that have never gone to the dentist in their life, and you can tell when they call in to give their dental tips that they're having fun learning about it too. So it's an awesome thing you're doing. And so one thing I wanted to ask you. What are the most often questions you get from the kids in the schools? Well,
there's different kinds, and it really depends on the mood that's set and the subject that they might focus in on. As an example, decay, a lot of people don't realize that decay is a communicable disease. We give it to each other by kissing. And I
didn't know that.
You didn't know that? So you better watch it. And so, but what happens is mothers, have the decay germs in their mouth. And when they kiss their babies, they give the babies the decay germs. Then when they get older, they have those germs in their mouth. And the sugars, of course, the germs eat. And as they eat it, they give off an acid, which eats into the tooth, decalcifies the tooth, and eventually makes a cavity. So that's how cavities are formed, from the acid. And, of course, to go a little further, acid is bad for the teeth, period. That's why people who suck lemons a lot lose the enamel on the front of their teeth and actually have to have restorations made on their front teeth from sucking on lemons. So it's acid that does it, but the germs cause that. So probably about 10 years ago, studies were done, and they found that an ingredient called xylitol, which is a sugar substitute, will actually do the opposite of sugar. It'll actually kill the germs that cause decay. And so, and they put it in gum now. So mothers that chew this gum, in fact, obstetricians oftentimes recommend that they chew this gum with xylitol in it, and it kills those germs so that when they go to kiss their children, then their babies, then they don't have the decay germs, so their kids don't get cavities. And so that really, some schools really sets off a real discussion with the kids asking about kissing, and what how it passes on decay germs. So that's been interesting.
So be aware that if you're kissing your baby, right? Yeah, you gotta be careful.
Unless you don't have those germs by chewing the gum that has xylitol in it, which, by the way, is in a lot of gums now. Just read the label, XYLITOL. And if that's in there, and especially the first ingredient, then you're killing the germs that cause cavity. It's all over the world, and there's been lots of studies on it now.
And you told me, so xylitol, so you can get it. I know Trident has it in
Yes,
there, right? Trident definitely does
Trident,
that.
I think Orbit does, and some others. The best is Spry, S-P-R-Y, and that's only sold at some health food stores, so it's hard to get.
Okay.
But that's the best one. But still, other gums have it, and if you just read the front of the label, the first name, if it's xylitol, you know that's the most abundant ingredient in there, so that's the best one to get.
And is there anything else we can get xylitol from other than, obviously, I hope
well, there are
something
mints, and Spry is the same that you can if you don't want to chew gum, but oftentimes gum is kind of good. In fact, with braces on, we tell people right after their appointment to chew gum for about 10 minutes because that loosens up the little fibers that are so tight that cause the discomfort. So it's more comfortable for them after their appointment if they chew a little gum for 10 minutes anyway.
Yeah, and fantastic. We're going to take a quick break. Is that cool?
Okay,
All
sure.
Right. And I hear you have a fluoride story for
Yes.
me. Yeah, so we're going to talk about that right
Okay.
right after the break on your hometown station, AM 1220 KHTS.
So, listen, if you're going to be logged on to Facebook and Twitter all day at work, you may as well stay informed while you do it. You can find KHTS on Facebook at facebook.com/KHTSAM. You can also find us on Twitter. That's twitter.com/KHTSAM1220. We post breaking news, traffic problems, news stories, and more to both Twitter and Facebook all day long. So what are you waiting for? Add KHTS on Facebook and Twitter now. Once again, you can find us on both Twitter and Facebook with the username KHTSAM1220.
Milestones are very special occasions. As the Santa Clarita Swap Meet celebrates its golden anniversary, they thank you for 50 wonderful years in the Santa Clarita Valley. Join the celebration on April 21st as KHTS broadcasts live from the Swap Meet with the famous 1948 Mack fire truck so kids can climb on board, clang the bell, and turn on the siren. Not to mention awesome music, prizes, and free giveaways. April 21st from 7 a.m. to 3 p.m. at the Santa Clarita Swap Meet. We'll see you there.
Your hometown station, KHTS.
It is your hometown station, AM 1220 KHTS. I am Kyle Jennings. Joining me in studio, a very special guest. It's Dr. Snow of Dr. Snow Orthodontics. And you can find more information at hometownstation.com, or you can go to Dr. Snow. That's DRSNOW.com. DrSnow.com. Easy website. Just head on over there whenever you want. And we're talking about, you had a fluoride. You teased me. You didn't tell me anything.
Well,
and so you have a story about fluoride
yeah,
in Texas.
with the kids, I usually, I have maybe 100 of them in front of them. We see about 8,000 kids every year. We screen them in the schools. And I'll ask them, how many people do you think there are in the United States without teeth? But first of all, I'll ask them, how many of you kids know somebody without teeth? And out of 100 kids, we might get 30 or 40 that know somebody without teeth. And so I said,
and you're talking about adults, right, with no teeth?
Yeah,
because the kids,
that's right.
kids
Yeah.
have teeth. Yeah.
Not newborn
Kids-
babies, right? And so they'll raise their hand, and I'll say, now that's a lot of people right here. 30 people that you and I know that don't have teeth, just in this room. So I'll ask them, how many people do you think there are in the United States without teeth? And there's about 350 million, 30 in the room that we know about. So I'll ask you, Kyle, how many do you think there are in the United States without teeth?
No teeth. Oh my gosh.
Just take a wild guess.
I would say, how many? Okay, what's 350 million people?
350 million, yeah. So some kids say a billion. There's not that many
Yeah.
people in the United States.
I'll say 800,000.
Okay, that's a good guess, but not good enough.
No, no.
It's 50 million. 50
Holy
million Americans
cow.
without teeth. And almost all of them lost their teeth because of gum disease. But then we talk about kids losing teeth, and adults too, but because of decay. And then I ask them, well, why do you think? Well, first of all, I tell them that there's more decay when I was a kid than there is now among kids, although it is getting worse. And as a matter of fact, I'll just as a sidelight tell you that it's the most prevalent disease among kids, most chronic disease among kids in school. As a matter of fact, 2 years ago, 500,000 kids in California alone lost at least one day of school. It's the biggest reason that kids lose school is because of dental disease.
No kidding.
That's right. And but I tell them, even with all that, still, there was more decay when I was a kid for one reason. And then I ask them what that reason is, and I have them all guess. And sometimes they do, sometimes they don't. But the answer is fluoride. They have fluoride where we don't. And if you have fluoride in the water, fluoride in the toothpaste, and go to the dentist every 6 months to get a fluoride treatment, you reduce decay by 50%. And then I also tell them by rinsing out with fluoride, you can reduce decay even more than that. But then I give them a story, and I tell them that in Texas there's this town where everybody in that town has brown teeth, but they don't have cavities. And so they traced it to the water, found that there was an abundant supply of fluoride in the water. So then they did an experiment, and they took just a little bit of fluoride up in a town in Connecticut, put it in the water. All of a sudden, everybody started having less decay. Now, at state law in California, you have to have fluoride in the water. And I think about 60% of California's water supply now has fluoride in it, reducing the decay in California. Still, it's getting worse because of the habits, eating sugar and that kind of thing. And so I had a patient that came in, I tell the kids, that he had all brown teeth. And sure enough, I asked him, are you from Florida? He was. He was from, no, not Florida, from Texas, that town in Texas. So, so that's an interesting thing. And oftentimes parents will see little spots on kids' teeth and little brown staining as the teeth come in. That's because they had too much fluoride as their teeth were developing up until about the age of 3 or 4. If they swallow their toothpaste, they get too much fluoride as the permanent teeth are developing. And so that's why sometimes they have white spots or little brown stains on their teeth from too much fluoride as they were growing. For that reason, they have little kids up until about the age of 4. After that, it doesn't matter because the teeth are developed, that not to use toothpaste that has fluoride in it or very little toothpaste that has fluoride in it.
It sounds like I need to get my son some new toothpaste, actually.
Or watch the amount that's used.
Yeah,
because they swallow it. And they get too much fluoride.
It tastes terrific, too, so why wouldn't it?
Yeah,
You know
that's
what I mean?
right.
So, Dr. Snow, thank you so much for stopping by.
My pleasure.
You can get more information at drsnow.com, or you can listen to the dental tips, which happen frequently during the 9 o'clock hour. That's my hour on the show, so I appreciate you coming by.
My pleasure.
Yeah,
Thank
excellent.
you.
And I love what you're doing with the kids. I think that's fantastic. Teaching them about dental health. Because sometimes it's a little scary. I remember going to the dentist as a kid. It was a little bit scary. But you would go into the schools and stuff, and the kids are learning and having fun. It's a fantastic
we enjoy
thing.
it. And if we give back to the community, we want to do it in our best area of expertise, which is dentistry, and that's why we've been doing it.
Excellent. Thank you so much.
Thank you.
drsnow.com or hometownstation.com. We got Families in Action coming up next. Stay tuned. AM 1220, KHTS.